You know February is Heart Month, but taking care of your heart health really should be a priority year-round. This is whether you're 25 or 75 or anything in between. Now's the time to make sure that you're taking charge when it comes to your heart health. So today we are joined by Dr. Bridgette Christopher, a cardiologist with Cone Health Heart and Vascular at Drawbridge Parkway, and we're going to talk about what you can do to protect your heart. So let's talk about this. Let's talk about what the most common misconceptions that people have about heart disease that we can set straight right from the get-go.
Love this. So there are really three things when people come in to talk to me and that they had never planned to come in to talk to a heart doctor before. The first is that they believe that they would feel it if they had a heart issue. So a lot of people said, well, I have not had that Hollywood chest pain. I've not had other issues. So I had no idea that there was any problem. Another thing that people say is, well, I don't have a family history of heart issues, so I thought that I would be fine. And the other piece of that is the flip side, that people have said, well, everyone in my family ends up with heart problems. No one's escaped it. I didn't think that there was anything necessarily I could do about it. So I didn't really see the point in going and talking to a doctor about it.
Okay, so we're going to dispel all three of those and kind of talk about them. So let's talk about this. Heart disease doesn't just affect older adults. Let's talk about how younger people are at risk as well.
Absolutely. So one of the important things that I tell people is that most heart problems take decades before they start to show up and having an issue. So for example, when we talk about cholesterol and how that can build up and cause plaque in your vessels, that's a process that can take 10, 20, 30 years or more. And people don't realize that it's something that they can start to identify very early in life and start to make changes to hopefully prevent future buildup. Another thing, people don't realize that they have so much impact in terms of what the next 10, 20, 50 years of their life looks like, is how they handle their lifestyle and make choices. And we'll talk a little bit more about that in detail, but absolutely, lifestyle choices that people make in their 20s and 30s impact 70s and 80s down the road. So it's really important to think about your future self. Another thing that people don't often think about is, well, I'm young, I don't have any heart issues, and even if I'm dealing with other things, other types of medical issues, it's probably not going to have anything to do with my heart down the road. And that's not always necessarily true. So it's important that even if you're young, to get any issues you might have sort of under control now so that they don't cause you problems down the road.
All right, let's talk about 3 steps all of us need to take to help reduce our risk of heart disease and take better care. I love 3, so that's like 3 easy things, 3 things that are manageable. It's not an overwhelming long list.
I love this. So one of the first things I tell people, and every time I talk to groups or patients or families, it's really important that people know their numbers. The American Heart Association has a great website with some very specifics about some of those numbers, but it's things like, what's your blood pressure? What's your cholesterol? What should your healthy weight be? Do you have or are you at risk for diabetes? These are all numbers that can be screened, that can change over time. And so knowing your numbers absolutely impacts how you manage your long-term risk. So number 1, know your numbers. Second is know your family history. Coming back to that beginning, family history isn't everything, but it's important. And so people who have an increased risk running through their family, it's important to know that early. So some families don't like to talk about things necessarily at the dinner table, but I tell people it's really important to have those conversations and know your family history so you can know your risk. And then the third thing, which we'll talk a little bit more, is making healthy lifestyle choices.
Okay, so we're going to use that as the jumping point. Let's talk about those lifestyle choices and those lifestyle changes that we can make that many people may not really think about that can really have a good impact on their heart health.
I love it. So one of the big things that gets a lot of attention is food. And I get a lot of questions about what should I be eating, what's healthy, what's not healthy. And there are lots of jokes on the internet and videos about how many different times we've changed our mind about what might be healthy and what's not. So I tell people to take a step back. What we know is things like the Mediterranean diet. And I'll talk a little bit about what that is. But we have now a lot of information that the Mediterranean diet is heart healthy, it's anti-inflammatory, it can be low salt, it can be low sugar, it can be sort of whatever you need it to be. And it's pretty straightforward. So lots of fruits and vegetables. That's the bottom of their food pyramid, really. Fresh food. So your food shouldn't, be able to sit on a counter for 2 weeks, like what my kids like to eat, and not spoil. It should be food that you're going to eat when it's fresh, and it's going to go bad if you don't eat it. It's healthy fats. So not all fats are bad. Things like olive oil have a lot of healthy fat to them. Things like lean protein, almonds, tree nuts, fish, if you like fish, are really important. And then whole grains. Grains aren't the bottom of the food pyramid for them. It's not the crux of it. They're more of a side dish. And it's not highly processed. So really the Mediterranean diet works for everybody, and you can adjust that to whatever lifestyle you might need. So I think diets probably are number one. After that, it's things like exercise. And people ask, what should I be doing? We have a lot of data that walking 150 minutes a week is what can keep you out of the hospital and help you live longer. Anything more intense than that, longer than that, is great and beneficial. But from a heart perspective, walking will do it. So we really encourage people to try to increase their activity in their walking. And then the next things are things like healthy sleep, avoiding tobacco, trying to minimize stress. Those are all part of the big picture of what can kind of impact the heart, but really focusing on the healthy food choices and the activity can make a huge difference.
What do you do if you do have the family history of heart issues?
It's a great question, and I think it's the taking ownership piece. So we talked a little bit on the last segment about making the lifestyle changes, knowing your numbers, and that's very important. But to take the next step, you have to talk to your doctor. And I think a lot of people are nervous and don't want to come in and say, well, I'm not having symptoms, but it's really important to talk to your doctor because there are some extra tests depending on what type of family history you have, what type of heart disease it was. There may be some screening tools and other things that we can do to try to get you more information so we can figure out what your individual risk is.
I think so often we just wait for the doctor to say, oh, you should have this test or you should have this test. So what kind of health screenings or tests should we be discussing with our healthcare provider when it comes to heart health?
I love this. So it's really about, there are different parts of the heart. I joke that my husband works in construction and I've stolen his terms. So I think about there being 4 construction systems of the heart. There's the electrical system, there's the pump, I call the valves in the heart, the doors and the windows. And then there's the plumbing, which are the vessels that supply the blood to feed the heart. And so all of those different things can have genetic components that can affect family history. And so it's sitting down with your doctor, taking a really close family history, not just to say, well, they had some type of heart disease, but what type, how old were they? And then we can use that information and go forward and say, okay, well, if we're worried about a valve issue, let's get an ultrasound of the heart. If we're worried about an electrical issue, we'll get an EKG. If we're worried about the plumbing, we may get something like a calcium score. So having that conversation and as much information as you can give to your doctor helps have the discussion about what the next best test might be.
All right, so many of us have a watch or have something, an app or some kind of wearable that tracks our heart health metrics. What should we know about them and their role in taking care of our heart?
So the first thing to know is that they are a tool. They should not rule your life. So we have a lot of people who come in and they are overwhelmed with the amount of information that they get from these wearable devices or apps or other things. So the first thing is, don't let your technology rule you. It's important and informative, but it's not the be all end all. So I really like these trackers for things like increasing activity, trying to get your steps up, trying to get your heart rate into a certain range, and you can put in all your little variables and it'll tell you, how many calories you burned. That motivational piece is really useful. The thing to be cautious about with them is that a lot of times they'll send alerts, and not all of those are perfect. And so if you're nervous, if you're not sure what's happening, absolutely talk to your doctor. But there are some times where I've told people to take the smartwatch off because it just fuels sort of all this concern and anxiety, and it's not necessarily helping them. So there are some tools. People who have a history of irregular heart rhythms, some of these devices can now capture an EKG, which is more helpful than just a heart rate pattern. But you just have to be very cautious that you don't get overwhelmed and overloaded with the information that comes from these trackers.
Okay, we've done a lot of information in the last like 7-8 minutes or so. If you missed any of this, if you think to yourself there's a family member or a friend that needs to hear what you just heard on this interview, it's going to be in the 2-Year Well-Being section of our website. Thank you so much for your time and your expertise.